Imagine living with constant pain, heavy bleeding, a swollen belly that makes people ask if you're pregnant. But yet, there is no child coming forth, and no one sees your struggle. This is the reality of many women living with fibroid. Welcome to Talk Health with Nurse P. Today we'll be discussing fibroid. Yes, uterine fibroid. Fibroids are non-cancerous growths that develop in or around your uterus. I take that again. Fibroids are non-cancerous growths that develops in or around your uterus. Now, your uterus is what is most people know as the womb. It is a part of your reproductive system. Now, imagine something is growing in your womb like a baby. It means you're having swollen belly, you're having all the signs that look like it is pregnancy. You're having fatigue, mood swings, back pain, severe pelvic pain, but yet it is not a pregnancy, and you're worried and you're concerned. Now, they can be as small as a seed and also as large as a watermelon. Yet that's big, they can be that big. Now, here's the shocking part. Some women don't even know they have fibroids, but for others, it's a daily battle. The person that are walking around with fibroid and don't know that they are having fibroid. Meanwhile, there are others that just the little growth that it begins with comes with a lot of battles and struggle. Now, here are the common symptoms that a woman having fibroid would experience: heavy or prolonged menstrual bleeding, severe pelvic pain, frequent urination, pain during sex, lower back pain, difficulty getting pregnant. Yes. Why? Because the fibroid is already growing where the baby is supposed to grow. So now where would the baby be? Not possible, right? Yes. So if you're experiencing any of these symptoms, the best thing to do, on what I would always advise, is seek for medical advice. Don't just assume that, okay, it is not fibroid, okay, it is this, okay, it is that, and begin to take medication. No. The best thing to do is to seek medical attention. Now, also, fibroid is not just physical. Yes, it's not about the belly growth, the back pain you're feeling, the pelvic pain, the heavy bleeding. It goes beyond the physical into the emotional. It has an effect. It takes a toll on your emotion, and this can lead to anxiety, low self-esteem, and even depression. Yes, because imagine your stomach is swollen and people are asking you, when are you going to give birth? Yet there's no sign of anything, right? It becomes a problem and you're worried and could even get into depression. Who are the women at risk, right? Who are the women at risk? Now, fibroids are more common than we think or we even hear about. Most persons go around with it and they keep silent about it until it gets very worse, right? Now, they affect a large number of women, especially women of African descent. Take notes. It affects large number of women, especially women of African descent. It means a woman that is an African has a link to Africa, has a tendency of growing a uterine fibroid, right? Now, another thing is family history. Probably there is a history of fibroid in your family. Someone somewhere, your great-grandmother, your grandmother, your auntie, your mother may have had fibroid in the past years. There is likelihood of a reoccurrence in maybe subsequent generations to come, right? Now, a woman who also has hormonal imbalance is at risk of fibroid, right? And then also, being a woman of reproductive age opens you up to chances of having fibroid. Yes. And then most importantly, obesity, large weight, excessive weight can actually expose a woman to this non-cancerous growth. Now, the most important thing to note is that or the sad thing about fibroid is that it is idiopathic. By that I mean the cause is unknown. Nobody actually knows how it happens, what happens for it to happen that way. but there are treatment options, right? Fibroid can be managed depending on the size, the symptoms, and your future plans. Now, there are three most important things to note concerning the treatment of fibroid. Number one is that there could be medications to control the symptoms, like the severe back pain, the excessive bleeding, the pelvic pain, and all of that can be managed because it is a symptom. Then there is non-surgical procedure that can be done to help. Example is the uterine fibroid embolization, where blood supply is cut short from the fibroid. That as long as it does not have blood supply, it will not grow, right? There are others like high intensity focus ultrasound, radio frequency ablation, and endometrial ablation. But in severe cases, it has to be taken out through surgery. Yes, and this is what most people used to fear when it comes to fibroid. That's surgical process. So most of them keep quiet. But when you keep quiet, you're actually allowing it to grow to the extent that you actually need a surgery. Yes, so surgery is usually done to take out the fibroid, and most times it could be so dangerous to the fact that there are so many blood vessels attached, and the risks of losing the woman involved could cause that they would decide to take out the whole uterus. It means no childbearing anymore for that woman. So, like I would always advise, if you see something, you feel something, you feel anyhow, seek medical attention. Seek for the advice of a qualified health professional. Do not keep silent. Your body is always speaking. I would keep saying and singing it. Your body is always speaking. Just listen to it and do what you need to do to stay healthy. With that, we'll see you in our next video. Please subscribe to our YouTube channel. Turn on the notification button so you'll be the first to see our post when we post it. Like our post, drop a comment, and share to your friends, share to the women around you. Let them know that their health is